The shoulder joint is considered to be one of those mobile joints in the human body. In today's video, we're going to talk about how to potentially avoid and rehab shoulder pain. Before we get started on some of the exercises that I want you guys to do to rehab and avoid shoulder pain, we have to discuss some of the anatomy coinciding with the shoulder. Okay, so Susanna's already on the table over here. And what I really want to emphasize to you guys is understanding that the shoulder joint is inherently unstable, okay? One of my professors in PT school explained it to me like this. You have a golf ball sitting on the tee, right? It's called the tee. Yeah, exactly. The golf ball sitting on the tee, right? The shoulder is the golf ball, and then the scapula is the tee, right? It's a not very stable joint. So when we're talking about the shoulder, I want you guys to understand that we're sacrificing stability somewhere for mobility. What that means is the shoulder can kind of go everywhere like this, right? Okay, so some of the anatomy associated with the shoulder. We have Susanna here. Go ahead and lower your legs so you can see. There's a lot of muscles that attach to the front part of the shoulder. To name a couple of very big ones, we have the pecs, both major and minor, that come across here, and they lie and they insert on the front of the humerus right here. Now, the pecs are a protractor. They come right here, and they also do horizontal adduction. It's basically coming across midline to utilize your pec muscles properly, okay? Now, once again, that inserts on the front part of your shoulder. Another major muscle group that inserts on the front part of your shoulder is your lats. That's on the back, right? So go ahead and roll over. Like flat. Turn your head one way or the other. Very good. The lats originate right here at the thoracolumbar fascia, and they come up and they wrap around to the front part of the humerus, okay? So two really major muscle groups that insert in the front part of the humerus, and that rounds the shoulder. The lats and the pecs also do internal rotation right here. The reason that's important is because we have major muscle groups inserting on the front part of the shoulder that do internal rotation, right? Heavy muscle groups, a lot of pulling and pushing that both insert into similar parts of the body. Now, I'm gonna go ahead and bring your hand up a little bit like that. Okay, rotator cuff muscles, guys. There's four, the rotator cuff, okay? Two in the back, one in the middle, one on the front. We're gonna address the back ones first, okay? The first one we have is the infraspinatus, okay? That lies on the top of the scapula and inserts on the back of the arm. I'm actually gonna have you lay your arm straight again like that. So it's gonna come right through here and insert right there, okay? The Teres Minor comes underneath the infraspinatus and comes up and blends in right beneath that. Both of those muscles do external rotation, okay? So external rotation. That's what those muscles are gonna contribute the movement to, okay? Go ahead and roll it back onto your back. Two other rotator cuff muscles is the subscapularis, another internal rotator. That comes in on the other side of the scapula, on the inside, and blends in, and that's gonna do internal rotation right there, right? So if you think about it, where it's coming in, its line of pull is gonna be right there. All right, the last one that we're gonna discuss is the supraspinatus, and that's going to do relative abduction of the shoulder right here. In most rotator cuff injuries, it's gonna be the supraspinatus that is usually compromised amongst other ones, okay? The reason I'm telling you guys this is because in order for the shoulder to go through its proper ranges of motion effectively, those rotator cuff muscles need to be stabilizing the humeral head, okay? So taking care of the tissues that surround the shoulder joint are gonna be very important. And now we're gonna walk you through a set of 5 different exercises and mobility drills that you guys can do to help rehab and prevent shoulder injuries. The first stretch I want you guys to understand is called the sleeper stretch. And this is gonna be to increase your relative internal rotation of your shoulder joint. So down here, Susanna's gonna be laying on her back to start. She's gonna position her shoulder out to the side, even with her chin right about there. So she's in parallel with her chin. She's going to roll over onto her left side right there. She's going to let her arm fall forward. And then she's going to give herself a little bit of overpressure right there, okay? So there's a few reasons why somebody may have a lack of internal rotation as a deficit. And one of those reasons is tight external rotators or a tight posterior capsule of the shoulder, okay? So if you guys do weightlifting or you're a pitcher or you're doing any overhead movement, I'm gonna show you something really quick, right? on my second pull of a clean or a snatch or when I'm on a barbell movement, I need to have internal rotation right here, right? A lot of the times the external rotators are gonna grab onto that humerus and become tight, not allowing for internal rotation. The next one's gonna be a smash. So go ahead and stand up. Go ahead and face the side over there, back. Okay, this is gonna be very good to help release external rotator pressure and reduce trigger points. Okay, so what did we talk about before? Infraspinatus, Teres, all these kind of blend in right in this area, and there's a lot of hot spots, trigger points that are in this area, right? She has very developed infraspinatus. All right here is pretty junked up too, right? She obviously works out a lot. So go ahead and show them what I was talking about with go ahead and releasing the external rotator. So once again, she's gonna lay on her back. She's going to find the spot that causes her the most discomfort. Now this takes a little bit of hunting and going around and understanding where she might have some hot spots associated with it, okay? She's gonna find the spot, she's going to relax her head onto the pillow, and then she's gonna roll gently over and she's going to floss her shoulder joint back and forth into relative internal and then external rotation. Okay, what this is going to allow for is a release of the posterior capsule of the shoulder to allow more mobility in the shoulder joint itself, okay? So hang out here 2 or 3 minutes a couple times a day, especially before you guys are lifting or doing any sort of athletic event. That'll really help you. All right, one more that we're gonna get to. It's called a lat stretch. I love this one because it releases all of that tissue right in the back there. You can see right here, all of this stuff gets so tight when you're using it a lot. Go ahead and show them. So we have a band hanging up from the bar right here. She's gonna grab the band, she's gonna wrap it around her wrist. She's going to kneel back with the opposite leg, as you see. Yep, you're good there. Right leg up, right here, and she's going to lean into the band, and then what she's gonna do, she's gonna rotate towards away, right here. And she should be noticing a very good stretch in this area. Do you feel that? You wanna do that? So come around on this side. I'm gonna show you kind of where she's stretching from. Very good. As you can see, go ahead and rotate. She should be feeling a stretch right in here. She might even be feeling it down here, depending on where the lat gets tight. All right, this can also stretch out that back side of the shoulder to give you more overhead range of motion, okay? So now we have Sam on the floor over here. So these are all things that you want to be able to do before you start any sort of exercise or things like that, right? We have Sam on the floor. Go ahead and assume the position. This is called closed chain relative shoulder flexion. So Sam's gonna bend down. He's going to be tucking in his core, keeping really strong. And he's in a position that's relative to any overhead movement, right? Closed chain, right? Hands firmly on the floor. Go ahead and go back down and do another rep for me. Core stays tight, right here. Protracted scapulas, firm on the ground. Very good relative closed chain shoulder flexion. Protracted scapulas. Protracted scapulas. Go ahead and come over here, Susanna. Thanks, Sam. The scapulas, right, when we're in that relative position, should be rolling forward to help the serratus underneath here stabilize the scapula, right? When Sam was going up and down, he should be stabilizing right here. His serratus is helping him out. This allows to offload so much pressure on the shoulders, okay? So doing that, 10 to 12 reps, nice, slow and controlled, just like Sam did, is really gonna offer you guys some benefits. All right, last one. Sam's gonna take a PVC pipe with a weight on it. Now you guys can also use a barbell, anything like that. Nice wide snatch grip, a little bit firmer. Go ahead and scoot your butt down that way to relax your head a little bit. There you go. All right, so the position that he's going to be in is he's gonna tuck his rib cage first. Firm tub rib cage, right? Set right here, abs are already set. He's going to slowly lower the PVC pipe all the way down. Very good. As you can see right now, he is in a position of power. He's created relative stiffness throughout his entire body, especially his upper body and upper torso. He's gonna come back up. This is a control exercise, guys. We're creating neuromuscular control in the shoulder capsule and having control of his lats, his shoulders, his pecs, and most importantly, what do we know about everything? It all comes from the core. He's gonna do about 10 to 12 reps of this, nice, slow and controlled, before he even picks up a barbell to allow himself the neuromuscular control to take care of his shoulders, right? All right, so once again, what do we know about the shoulder? Mobile joint, right? We have a lot of mobility, therefore stability is compromised, okay? okay? Taking care of the tissues that surround the shoulder are gonna be very important for you guys to maintain good shoulder health, all right? If you guys know anybody that is struggling through shoulder injuries, or if you guys have any more questions about how to avoid shoulder injuries, leave a comment below. I'll see you guys next Friday.